Thank you, Katie, for the introduction. So I'm going to be talking to you a little bit about medical marijuana or cannabis and CBD. Um, and one of the things I do is I live in Pennsylvania and Philadelphia, and Pennsylvania is one of the states where you can certify to get medical marijuana. So so we'll talk about the different, some states you can get medical marijuana for pain, others you can, and others it's sort of, you can kind of just, it's legalized in general. So I'm going to be presenting this in a somewhat similar way, is as if you were a patient seeing me who had questions about medical marijuana, and kind of giving you the information you would need to know. And this is something that's new. I've been at Jefferson for 14 years. When we first started, when people would ask about marijuana, there really wasn't a whole lot to say. There wasn't a whole lot of evidence that it was helpful for pain at that point, but people were using it. It was sort of hard to recommend or do much with that. But now I think now that we've learned a lot more over the last few years, especially in states like Pennsylvania, where it is, you can use it for medical use. We've learned a lot and started to study this, and it has a lot of potential benefit in a lot of our patients. So anyway, let me make sure I'm going to advance the slides here. Okay. So what we're going to talk about is, when would you ever, consider using medical marijuana for headache, and what about, we're going to use the term cannabis mostly, but what kinds of medical cannabis are available and what might you recommend for using? How does it work, and does it actually work for patients with migraine or other headaches? This is where things stand right now, and this keeps changing, but as of right now, there are a number of states where there's no doctor's recommendation required to get medical marijuana. Colorado was the first state, but also the District of Columbia. And these are places where you can simply just purchase marijuana for whatever reason. It doesn't have to be for medical reasons. Then there are other states, like most of the states in the Northeast, like Pennsylvania, New Jersey, Delaware, where most of my patients are from, where it requires getting a recommendation or certification from a physician. And in the way this is done is different, and almost every state has their own rules and some different conditions that can be where you can consider using medical marijuana. And then there's most of the other states who do not have either one will have the ability to get marijuana with low THC content. And this is mostly for patients with certain types of epilepsy, where the CBD has shown to be more important than THC for certain types of epilepsy. So those are patients where, in those states, mostly it's not available, but this is changing. Some of the states that are in the light green are kind of changing over to dark green. There are still a few states that don't have any kind of medical marijuana available, though. But this will keep changing. Obviously, the trend is for the blue and dark green. And I'll kind of talk about why, maybe some approaches might be better than others. In terms of, if you live in Pennsylvania, where again, most of my patients live, and it's sort of like, when we started out, when medical marijuana became legal in Pennsylvania, there were about half as many or a third as many dispensaries, and they multiply. Of course, they tend to be in places where a lot of people live. So in Pennsylvania, most of them are clustered around Philadelphia, Pittsburgh, and Harrisburg, and Scranton. Not so many in the more rural areas, and they're really run like a business. That's how they run. And whatever state you live in, because marijuana is considered a Schedule I drug on a federal level, the marijuana that you get must be grown in that state. So even though you might think it might be a lot cheaper to grow medical marijuana outside in Texas or California or Mexico, if you live in Pennsylvania, your medical marijuana is probably coming from a greenhouse somewhere. And that's going to be in some states will have rules about, if you have a license for medical marijuana in another state, you can bring it into that other state, and other states will not allow it. So technically, if you're in Pennsylvania and you decide to go on vacation to Georgia, you're violating the law. So it's a little bit frustrating, but as of right now, marijuana is a Schedule I drug. And so these rules are a little bit strange. And often I have to tell patients to kind of look and see, hey, which state are you going on vacation to? You got to make sure you should know, and before you go, if you can bring medical marijuana with you on that trip. So for Pennsylvania residents, I'm going to talk to you mostly about my perspective. And some of the time I'll talk about things in other states and how it works. But every state is different. Like, so for Pennsylvania, if you are someone who thinks, medical marijuana may be appropriate, you actually don't even have to consult a physician first. You can register on the website as someone who might, be interested in getting medical marijuana. But then you have to see an approved practitioner to get certified. And this is different for every state. So in Pennsylvania, you get a certification. The doctors are, you take a course. It's a 4-hour course to learn all about everything you need to know about medical marijuana. You take the course and you can apply for the ability to certify patients. And then once you, have that ability to do that, you can see patients and then go on the website and complete some forms. The forms only take a few minutes to fill out for patients to be approved. And when you're certifying patients, you can specify, the reason for certification. Is it for chronic pain or epilepsy, or is it for spasticity or some other disorder? And then you can even specify these are the types of medical marijuana that would be appropriate. So if someone is interested in getting, has foot pain, they want a cannabis product to help with their, topical pain, that's fine. They can do that. But in most cases, you're going to allow patients to have the option to try different formulations. So once patients are approved in Pennsylvania, it's a $50, fee for medical card. And in Pennsylvania, the idea is that your doctor, who you see for whatever medical condition, will be the one to certify you, or can have someone in their practice. So at Jefferson, for example, if you have cancer pain, there's a doctor at the cancer center who certifies patients for cancer pain with medical marijuana. And so she's an expert in cancer and cancer pain, and is able to give advice related to that. And hopefully your doctor who you see for migraine, we have doctors in our practice like myself who certify patients for migraine. So I have expertise in migraine. In other states like New Jersey, the fees for doctors to become certified, to recommend medical marijuana are a lot higher. So a lot of primary care doctors are like, I don't really know if I want to spend that much money on these fees if I'm only going to be certifying a few patients here and there. So in other states like New Jersey, most of the doctors who do certifications are really doing a lot of marijuana, a lot of certifications. So you might have a marijuana doctor who is a real expert in marijuana. I do not consider myself an expert in marijuana. I never use marijuana. And so it's a little bit different. So in those kinds of places, the doctors might say, yes, migraine, or that sounds appropriate. You definitely have refractory migraine. I'll certify you. But they may know more about medical marijuana, but maybe less about the disease they're treating. The other issue that comes up in some states, it can be very expensive. So I think that you can hear my bias. I like the Pennsylvania program because it's not terribly expensive. The goal is to not make it so expensive to become one of these doctors who certifies, that you're not charging really high fees to certify patients, and it's reasonable. Like we charge $25 for all the forms we do. But if you go to other places, other states, those fees may be much higher. So anyway, once you have your medical ID card in somewhere like Pennsylvania, you simply can take your medical ID card to any dispensary you choose. You can say, I want to go to Pittsburgh for medical marijuana. That's fine. Obviously, you probably want to go somewhere close, but you can shop around. If you live in a place like Philadelphia, there are many places you can choose from to find if you have a dispensary that you find is a better fit for you. If you look, they all have nice websites, and they have menus on the websites that describe the different products. So it's really, once you have the card, you are kind of now the customer, and you can go from place to place. So that's how it works in Pennsylvania. Of course, and I kind of like the idea. A lot of our patients who go to dispensaries have found it really helpful. The people there are experts. So even if I am not an expert on all the different forms of medical marijuana, the people at the dispensaries, the buds persons, they are, and they can often be really helpful for a lot of our patients who come in who've never used marijuana or cannabis and have concerns about what they should be doing and how much they should get or what kind of products might be appropriate. So that's kind of the process that we go through. Now, I think that I've heard sort of from patients who live in states like Colorado, California, where it's more what you can just kind of get what you want. It can be a little bit tricky because, you know, again, if you're naive and if you've never used marijuana, some people are going to find that they're not going to tolerate it as well. So you have to be a little, I feel in some of those cases, I like the model of that there is some supervision and some oversight. Some people would argue that actually, you know, letting patients be able to use a relatively safe therapy is probably better. But this is how it is in Pennsylvania, and most states have something similar to this. So I'm going to be talking about some facts or myths about medical marijuana and how it relates to headaches. So how about this one? Medical marijuana or cannabis is more effective for migraine or cluster headache than other pain disorders. What do people think about that? Okay. No. Okay. Yeah. So this is actually not true. And I think I get this a lot that, you know, a lot of people will see me and says, my friends tell me because I have migraine, I really should use, you know, marijuana would be a better choice. But there's actually some pretty good evidence that medical marijuana is actually effective for pain in general, not necessarily specific to migraine. There's been studies looking at opioids. Patients who use medical marijuana, they actually use less opioids, or actually in some cases are able to stop using opioids with medical marijuana for pain. There's very good evidence that patients with spasticity, such as a spinal cord injury, multiple sclerosis, that it's effective. In fact, there's actually approved formulations in Europe for spasticity related to multiple sclerosis and medical marijuana. And there's some pretty, you know, emerging evidence for other pain disorders like fibromyalgia and neuropathic pain. So not specific to migraine. Again, mostly not a lot of migraine studies, and there's some reasons for that, but it's actually good evidence that it may be helpful for pain in general. It's a little tricky with migraine because obviously, you know, you like to have controlled trials with the placebo to show that it's better or worse and what the side effects are. Also, it's kind of tough because in most migraine studies for acute medications like, say, a sumatriptan or an acute medication, they want patients that have discrete migraine attacks, like a certain number of times from a month. Not too many migraines, but not migraine every day, but not too few either. So they're looking for people that have a migraine once or twice a week. They take something, 2 hours later, they feel better. Most people who would be candidates for medical marijuana are not the patients that have a migraine once a week. Those patients are usually do okay with the therapies we have available. They're usually people that have more of a chronic daily headache or severe migraine. They have to, you know, miss work or have to miss out on activities and having some significant disability due to migraine or headache. And also it's not necessarily better than other things that are out there. So there's no kind of head-to-head studies. So sometimes you'll have someone who, you know, maybe they do have really difficult to control migraine, but if they've never been on other therapies, I think it's reasonable to say, you know, you might want to try some of the more established therapies that we know work before you kind of move on to medical marijuana. So this is Pennsylvania's qualifying medical conditions, a big list. Some of the things on this list are more on there because of patient advocacy than they are that evidence that it actually works. And I think that there's some things on it like HIV or AIDS there. You know, I think it's obviously not for the HIV itself, but maybe for patients with anorexia, right? So it's not, but yet again, and in some states, there is a specific indication for migraine. And I would say that in general, I would kind of disagree. Someone with a migraine, once in a while, they can get by with taking an Excedrin or a triptan. they certainly would not be someone I would say would absolutely need to be on medical marijuana. They could probably manage in some other way. So in Pennsylvania, like in a lot of other states, the indication we typically use is severe, chronic, or intractable pain, and especially if things have not been helpful for them. So we actually have done a survey. We've certified a lot of patients over the last few years, and almost all the patients we see who are looking to get certification for medical marijuana have daily headache. Often it's most commonly migraine, but often it's things like post-traumatic headache or new daily persistent headache. A lot of the patients who we see have, in addition to headache, have other disorders such as anxiety problems, insomnia. And some people use it. Most people are using it regularly, a few times a week. Some patients use it every day. And most people are using inhaled formulations. And there are a number of side effects. I think fatigue is probably the biggest for some people. Again, that depends on the formulation. And it does seem to reduce the number of acute medicines people use. So a lot of people who are taking a lot of acute medicines, they run out of their medicines, they seem to do very well. And some of the patients with anxiety or insomnia do better as well with marijuana. So we talk a little bit about how does cannabis work? Well, the reason people can find cannabis to be helpful is we have cannabinoid receptors. And there's two of them that are well known, and the CB1, that's the first receptor, is mostly in the brain, and the CB2 is mostly outside the brain. And even though CB1 we would think would be the most important, there seems to be some evidence that the CB2 receptor may be important in chronic pain. And what endocannabinoids, are sort of our natural cannabinoids in our body, do, and there's a few of them. It's actually not so much like that it's not so much that they do a lot by themselves. It's more of a modulating thing of other neurotransmitters. So if you think about like glutamate or magnesium or other brain transmitters that they make, activate the brain or calm it down, these are more of a modulating role. And some of the effects are kind of similar to what you might see with medicines like ibuprofen, naproxen, things like that. And there's actually a lot of interest in, well, instead of taking, something like marijuana, could you do something to increase the amount of natural endocannabinoids or prevent them from being broken down so quickly? Would that be a potential treatment? So right now we're still, using marijuana, of course, but in the future you could see something where you're using your body's own endocannabinoid system to accomplish some of the same things. So in terms of what to do, a lot of patients then, once we decide that someone wants to do thinks it might be helpful to try medical marijuana, what do you tell them to do? So how about this one as a fact or a myth? For patients with migraine, edibles or capsules are usually what we're going to recommend. What do you guys think about that one? Yeah. So actually, when it comes to medical marijuana, we usually don't recommend the edible formulations very often, or the capsules. There's a couple reasons for that. First of all, in migraine, when you talk about treating acute migraine, you generally want to try to treat it early. Oral formulations of cannabis, especially these capsules or making it in a brownie, they take a while to work. So if someone's having acute migraine and they want to get some, more immediate relief, probably the oral formulations are not going to be helpful. I actually discourage them for people that are trying to take it for acute migraine. Obviously, you can take it for chronic use. It may be acceptable to use oral formulations, but sometimes that kind of can backfire a little bit. So we know that with other pain medicines like opioids, there was a push, when I was in residency 20 years ago, you want to make a long-acting opioid that lasts for a long time. What happened, though, was because the medicine took longer to work, people took more drug. So they were someone taking OxyContin, they may have had to take 60 milligrams of OxyContin a day, when if they had taken a shorter acting, they might have gotten away with a much lower dose. So when you have a drug that takes a couple hours to work, there's a tendency to say, I guess I got to take another one of these, so then sometimes people are taking more more than they would normally have if they had just taken a tincture or smoking or vaping. So something just to be, and also there's the issue of liver metabolism. So if you if you have people that are using brownies, you might feel like you're on another planet, and your friend might say, well, it doesn't feel like it did anything to me. So there's more variability from person to person with the oral formulation. So in general, especially if it's not for daily use, we won't recommend the orals often. So here are some of the different types of medical marijuana, and I was from the generation or school where no one really used marijuana, but I was in the Peace Corps in the 90s, so I met a lot of people there who were used marijuana a lot. So anyway, obviously smoking and vaping is some of the most common use. This is dabbing, where you're putting a small amount and you're heating it. A lot of our patients like the sublingual tinctures where you put them under your tongue. And I think for some people, this is a little bit more of an acceptable thing. You don't have to if you're out in public or something like that, you can use them. They do work pretty quickly. Sometimes they have a bad taste. So that's probably the biggest complaint people have. Obviously, there's a lot of orals and, capsules and things like that. Obviously, Marinol, people, using that for anorexia or other conditions can be helpful, or cancer. There are nasal sprays for medical marijuana. They're not used a whole lot, but they're available. There's even, patches and topical treatments that can be found. There's even rectal and vaginal formulations. I think Jefferson was involved in developing one for menstrual cramps. So there's so many things that are available, so many different products, and it's a really entrepreneurial business, and it's competitive. I mean, these dispensaries really are, it's big business. They're really trying to promote themselves and make it look cool and have different formulations available for patients. And that can be a little confusing when you're a patient. You're looking at I kind of tell people it's like if you go to the Cheesecake Factory and you're like, there's 12 different types of paninis, and I don't even know what a panini is. And, for a lot of our patients, they see these menus with, all these different oils and different products and tinctures and capsules, and it can be a little bit intimidating and that's why most of our patients will work with someone at the dispensary to kind of come up with a plan. So there are many different compounds in cannabis. So the two that most people are aware of is the THC, which is a psychoactive compound, and then the CBD, which is not psychoactive. They both act on same cannabinoid receptors, but of course THC is much stronger. And THC and CBD can be synergistic in some cases. So sometimes taking a combination of the two products can make things better or worse. And there are also different types of plants. So there's differences between marijuana, which is really more the flowers and stems of the plant. That is more psychoactive, high THC. And of course, the fiber of the plant, you might be familiar with hemp, which is a very low THC product with mostly CBD. So there are some differences there as well. So how about this? So for patients with pain, we typically recommend products with THC and not CBD. What do you think about that one? So that is actually generally true. So CBD by itself, with no THC involved, there's really no evidence that it's effective for pain. So in general, if someone has pain disorder, especially acute pain, that we'll usually recommend something with at least some THC. A lot of the CBD products that you'll see, it's not really known how much of that, they're not really the quality is not really, control is not necessarily very good. The dose might be too low to be effective for anything. So again, in theory, CBD could be effective for pain, but there's no good evidence that it is. So I think for most of our patients who ask about, I would just do CBD oil I saw on TV, I can buy it on Amazon. I don't typically recommend that. I'll rather recommend some other, if someone's interested in a non-prescription treatments or natural products, I'll recommend other things other than CBD. So THC is, besides pain, which I mentioned, there's also good evidence that it helps with nausea and vomiting, patients getting cancer chemotherapy, patients with HIV and AIDS, some evidence for other spasticity disorders, tic disorders like Tourette's, even Parkinson's disease, maybe some benefit there. And then CBD, of course, the safety is very good. There's no really, potential for abuse. It doesn't seem like it converts to THC. And there's some studies that are ongoing about where it may be effective, but probably the most proven is for epilepsy, certain types of epilepsy disorders in kids that are relatively rare. So this would not be like a first-line treatment for most of the common types of epilepsy, but that's one reason where we will recommend it. When it comes to marijuana, there are a couple of different, not clear that these are different species, but different types. So there's the sativa plants, and sativa is less sedating, whereas the indica plants tend to be more sedating. So if you go to a dispensary, you might see that this one is sativa, this one is indica, or it'll be a blend in many cases. And they'll often have that on there. And in general, some people like to maybe use marijuana before they go to bed as a rescue medicine, and they can lie down or sleep. But for other people, they would prefer not to sleep. They may use more of a sativa-based product. And the sativa does have, and it's not unclear exactly how important this is, but the sativa does have a little bit more THC by percentage. The indica is a little bit more CBD. And then there's other issues about the flowers or something called terpenes and there's so many other products. So just seeing the milligrams, the THC and CBD doesn't always tell you everything you need to know about the product. So how about this? Medical marijuana is safer than many other pain medications, including opioids. Would you agree with that? Okay. So this is also seems to be true. So first of all, compared to opioids, there's really, people do not, it's really no risk of overdosing with marijuana. It just doesn't happen. And some people do get a psychological dependence on marijuana, but the physical, you're not going to have, if you stop medical marijuana, you're not going to have problems with your heart or your blood pressure or things like that. The kind of physical dependence that people have with other drugs. And pretty low rates of addiction compared to things like alcohol and cigarettes and prescription drug, opioids. And I also feel like, if you kind of think about a lot of our patients who use chronic ibuprofen or aspirin, those have a lot of potential side effects too for your kidneys, your stomach. So I think for a lot of reasons, the medical marijuana may be actually a very safe, especially for adults. Older patients may be a very safe option. Most people do feel more relaxed when they use medical marijuana, but there are definitely, potential issues with memory, what time the concentration. And so obviously if someone is a truck driver or a pilot or even a student, medical marijuana may not be the best choice for them. Also, there's this feeling of, wow, food tastes really good. And some people will eat more when they use medical marijuana. And so certainly at high doses, people can have side effects like an increased heart rate. There's one thing that's kind of rare, but I've seen it at least a couple times, where if you take a lot of medical marijuana, and this is usually frequent users or heavy users or chronic users, sometimes it can actually cause nausea and even vomiting. It's called cannabis hyperemesis or throwing up syndrome. And it's not that rare. And so at very high doses, it may have a sort of a negative effect. And then it's not recommended in pregnancy. So, marijuana does cross the placenta, it does cross into breast milk. There may be potential for serious cognitive effects. So now if someone is potentially in the early planning stages where they may become pregnant, it's something I mentioned. It seems to be more of an issue sort of later on in pregnancy and then in breastfeeding. So not something I would tell people you need to be off of all marijuana before trying to become pregnant, but I do have this discussion in people that are, younger patients who might want to become pregnant. So if I see someone for medical who's interested in medical marijuana, the first things I look are, is this appropriate? Is it likely to help? And sometimes I have a lot of enthusiasm. I think that might make a big difference, and it doesn't work. And some people I'm a little skeptical about, and they do really well. So I think as long as it's safe and someone qualifies, and they certainly have a need, they have refractory headache, I'm okay with doing a certification. It's not, like I said, in Pennsylvania, it's not extremely expensive. The other thing I want to ask about is, how would you use it? So for people that say, I don't have a good rescue medication and I want to use it acutely, I think that works pretty good. I think for daily use, you have to have the discussion is, are you going to use it as a preventive? Marijuana is not meant to be a once a day kind of therapy. It doesn't last that long. So you'd have to almost be willing to use it every day or almost multiple times a day to be preventive. And then it could be more expensive if you're using it every day. So would that be something that would be an issue? The other thing is, I think it's about practical things. So, do you have a kid who lives with you who would likely steal your medical marijuana? Or, are you at a job where they would do drug testing? Marijuana stays in your urine for a really long time. So, you have to have those considerations. And also the history of someone, even though the rates of addiction with marijuana are lower, if someone has a substance abuse disorder, and let's say they're, abusing opioids, I'm not so sure that I would say, well, now let's add medical marijuana. You might want to address the other issues first before recommending it. And so I think most of my patients, I'll say, certainly if you're just using it as a rescue, especially if you can't take other medications or they're not effective, I think that's good. Again, for prevention, you have to use it regularly. And anyone who you consider this for has to have some disability. If migraine doesn't affect your life, doesn't give you any, really affect it in a negative way, I don't know that I would recommend marijuana. And also it should be someone like it shouldn't be like first visit. Usually I'd like to know the patient, know what might be helpful for them. And we do have everyone sign a contract prior to certification. Some states do not require this, but it's something that I think is a good idea. Not just to, we have a sort of information sheet where people learn all about medical marijuana, but we also have rules. Obviously, it's just for you. You're not sharing it with your friends. It's you're not taking it, using it, and then going out driving right after using. So, I think that is important to do, to have some patients sign a contract and learn about what's involved with the treatment. And in the future, right now, it can still be a little frustrating. There's a lot of trial and error. When I tell people to buy small amounts because you don't know it's going to work for you. We don't know exactly how well it works. Most of our patients who've done really well, it's not like I don't have a great sense about when it's going to work or not work. It could be expensive. Insurances don't cover it. And of course, there can be side effects as well. And I think in the future, we'll have some better sense about who would be a candidate, when should we use it, how does it compare to other medications and treatments. And I think eventually, we'll have pharmaceutical products which either may work like medical marijuana or have similar effects, or maybe doing things like enhancing our own body's endocannabinoid system or preventing the breakdown. So I think that it's a really exciting area of research, and we're still really, really in the infancy of what we know about this. But I think this is a really important potential development in the future. So with that, I'll stop.
Okay, great. Thank you so much. That was a great presentation. I have a few questions here actually that we received. So Dr. Marmura, do you recommend a consultation at your dispensary prior to your purchasing of your medical marijuana?
Oh, absolutely. Yeah, in Pennsylvania, they do have, the people who work at the dispensaries are very knowledgeable. And I think that you want them to give you a sense about it. When you see them, you might say, what are your goals of treatment? You should go into the dispensary knowing what your goals are. So if you say, my problem is I have migraine every day, I want to get some relief so I can sleep at night. Is that your goal? Or is it more like I need to take something, I have these 2 bad days a week and nothing works? What is your goal of, the treatment? So you should know that. And then when you work with the person at the dispensary, they should give you advice. I mean, they're motivated to have you do well. Because if you don't do well and you're not happy, you can just go somewhere else. So they want you to be motivated and do well with the treatment. So I would definitely take advantage of that. Absolutely. I always recommend, even people that, unless someone says, I have this product, I know it works, I actually have the name written down, then I almost always recommend getting a consultation when you go. Absolutely.
Okay, great. And you were saying that so when you go to your dispensary, each state can only carry their own medical marijuana.
Right. It's grown in that state.
Yeah, so it's always going to be different. So for instance, if I am in Pennsylvania and I go to California, and can my medical marijuana card from PA purchase medical marijuana in California?
No, definitely not. It has to be, so your medical card is only good for the state you live in. However, there's some states, like California, where you don't need a certification.
Right, that's true.
Colorado. So of course, if you're going to those kinds of states, it doesn't really matter. But no, absolutely not. The rules are different from state to state. So you can go across the bridge to New Jersey. Medical card is kind of useless when you go across the state.
Right. And I live in Delaware, so you cannot give me a medical marijuana card for my state.
Right, exactly. Yeah. And now if I was to get a certain, a medical license, so I'd have to get a medical license in Delaware and then now some states like Delaware, they actually, Delaware, I believe you don't actually have to have specific license to recommend medical marijuana, but they want some kind of recommendation. So they would want a specialist who treats your spasticity or migraine or Parkinson's disease say, hey, I do think this is safe and you can do it. So Delaware is a little bit different. Sort of the good news is I think that it's sort of, there's one less barrier. So some people just are like, I don't want to take a 4-hour course and spend even though the registration for the medical marijuana ability to do certificate is not that much in Pennsylvania, it's still some time. And again, if you don't really see a lot of patients for medical marijuana in general, I'm not sure, you might not consider it worth your time. With Delaware, it's more like the doctors can recommend it if they feel it's appropriate. But then I think the negative about that is I don't know if they have the knowledge, they're not as knowledgeable about telling you, this is what I would recommend, this is what you should do. That kind of tends to be a problem.
Right, and that's when maybe the dispensary people would help you more.
Yeah.
Okay. And so again, if I would go to California, the what you would get would be completely different.
So if you were to, let's say you had a product that you liked and you said, this is my product I like.
Right.
I'm in Pennsylvania and now you're going to move to California, you can take the details and they would likely be able to find something pretty similar in California. So that's kind of what you would do. But again, it's still, even if it looks like, okay, this much THC, this much CBD, this amount of milligrams, there's still been a lot of other factors involved. So, yeah.
Okay, yeah, that was a question, because if say someone's going somewhere for a week vacation and you can't take it with you.
Right, exactly.
Right.
Yeah, you have to end up doing a little research before you go, which is frustrating.
Right, because you said they all have websites. Okay. Oh, so you had mentioned something about jobs and drug tests. If you are approved for a medical marijuana card because of your chronic migraine,
right,
would you be okay if your drug test at work came out positive because you have a medical marijuana card?
Yeah, you have to check your job, and it may not be okay. If you're a truck driver or you're a pilot, it doesn't matter if it's for medical reasons or not. It still would be you would have problems.
Okay, sure.
Yeah, so it depends on the job. Most jobs, the drug test, you're talking about those kinds of jobs.
Gotcha. Of course, yeah, driving and that type of thing. Okay, good point. Oh, so another question. What do you think of, you were talking about the different types of medical marijuana. What do you think of the inhaled type of marijuana? If you're still smoking it, will that affect maybe down the road your lungs?
Yeah, that's the negative. That's why, generally most patients don't use that type for medical reasons. I think that the risks are still a lot lower than if you're smoking cigarettes. But if you can, I would, especially if someone's using it every day, that may not be the best form.
Okay. Um, are there specific strains found most effective for chronic pain?
Yeah, I think that a good rule of thumb, I usually tell people that you want a 1-to-1 ratio of THC to CBD is probably a good place to start. I think someone on the chat mentioned a 2-to-1 ratio. The Harlequin strain, which I've heard of, is pretty good. So yeah, I think that, and there are, even a lot of the for nausea, actually the high, there's really most of the evidence is for THC. So if someone's that might be where you don't even necessarily need to use the CBD. If someone is using it for nausea, mainly the THC is more important. So I usually will recommend trying a 2-to-1, 1-to-1 ratio, with at least, mostly. I would not recommend there are some products when you go there where they say this is almost mostly CBD, but that would be more for epilepsy. So sometimes you'll see a product where it's minimal amount of THC and mostly CBD, but that's really not for pain. So I think you need at least 50-50 THC to start.
Okay. I'm trying to read something.
And someone mentioned the 5-to-1 ratio also.
Oh yeah, I just heard that. Okay.
So those are, yeah, I think the issue is that you don't want a CBD only product, or mostly CBD product. You need some THC for it to be able to work. So I think start with the 1-to-1 ratio. I think those are all pretty good.
Okay.
And I don't recommend, I think someone said the doctor recommended a CBD oil for chronic migraine. I really feel like that's, I'd rather have someone have someone spend their money on, like a cognitive therapy or magnesium or riboflavin or something that actually is known to work. I think you have to be careful as a doctor to recommend something that has, not only no evidence, but it doesn't even theoretically may not work. So I think you have to be careful about recommending something that's very unlikely to work. And, with the CBD only products, I can't really recommend them.
Okay. I mean, I tried CBD myself, different types, and it didn't help me. So
yeah, I mean, it's safe, but it's, it does, it costs money. So,
yeah,
you spend the money on CBD oil, which probably would not be very effective, or buy something that may be more likely to help.
It's not cheap. It didn't help my dog either, everybody.
Right.
Okay, let me see. Do you see technology in the future indicating what type of medical marijuana would be effective for each individual?
That's a good question. I think that we'll have probably before that, I think the next step will be what might be helpful for certain diagnoses. So where we could say this is effective for acute migraine, this is more for preventive treatment. So that's probably what the first thing would be. I don't think we know enough about the genetics of, to really be able to say that. That's probably far in the future. We don't even know the genetics about who does well with triptans, for example. So much less medical marijuana. So that's probably going to be, many years down the road for that.
Very true. Very true about the marijuana, the migraine drugs. Does Dr. Marmura only treat his patients for MMJ?
Well, so most of the practice like ours, so I will see patients who see myself, but also other providers at the headache center. So we have a relation. So if you see Dr. Young, and I can certify you, and I can, but usually what happens is I see you for the medical marijuana certification, talk about it, but then I would assume your normal care will be with Dr. Young or Dr. Silverstein, one of the other, whichever doctor you normally see. So, but I think that, I think that most states really discourage, so this is not like, some states where you see a marijuana doctor and you're never going to see them again. They certify you and say, good luck. It's really more that you have it as a relationship. And also, I think it sends a bad message to say, this is the only treatment. If someone is interested in medical marijuana, I'm not going to tell them, okay, stop all your other medicines. This is the only thing you should do. It works well with other treatments. So I like when patients are, this is one tool and one type of treatment, and they're still using all their other treatments together. And, being that medical marijuana is fairly safe, it can be combined with other treatments, medications, non-medication treatments. So usually it's good to have someone who's, I like the way it is in Pennsylvania in that you see the doctor that or someone from the practice that like I mentioned, the cancer doctor, Jefferson, she sees all the patients in the practice who potentially need medical marijuana. She doesn't just see her own patients. And I think we're kind of the same way. But if you see a doctor in another state for migraine, no, I would not certify you unless you're our patient. We were going to be kind of seeing you at least periodically. You are supposed to see patients, if you see someone one time and you certify them, even if you do well, you need to see them, you need to see at least once a year to make sure it's working and talk about it. That's the kind of where the law is right now.
Right. And actually, you just brought up a good point. So I will ask the last question. Do you ever have patients that maybe will do really well on medical marijuana, and then maybe you'll be able to decrease some of their other medications?
Oh, that happens all the time. Yeah, I think that's one of the biggest reasons to think about medical marijuana. And it's not just like, opioids or triptans, but even just taking, non-steroidals they have potential bad side effects if you're taking them every day too. So for a lot of people, that's one of their biggest motivating factors. I think the only negative is about people say it's a lot cheaper to take this, aspirin than it is to go to a dispensary to get medical marijuana. So that's kind of a tough sell. Is if someone's happy, taking a bunch of aspirin and it's cheap, they may not want to do that.
Yeah. Do you think it probably will never be approved as a medication under?
Yeah. Right now it's being sold so that the companies can make a profit. It's not, it depends on where you are, but it's not inexpensive.
No, it's not.
Yeah.
Okay. All right. Well, great. Well, thank you very much. And we appreciate your time.
All right. Thank you.
Thank you.